Insemination is the simplest and the most basic form of assisted reproduction, and this is indicated mainly for people who have what we call unexplained infertility, people who we cannot find. We have done those examinations or tests and we can't find any reason why they're not having a child. So it's mainly indicated for them, but also there are some other things that we need to look at from our evaluation. It's not probably the first choice of treatment for people above 38 because the success rate will be lower. So, but if a woman is below 38 and we don't find any reason for infertility, intrauterine insemination is one thing to look at. In cases of cervical hostility, where the sperm is just being killed at the level of the cervix, we can use intrauterine insemination, or women who have had surgery on their cervix and is making it to be hostile. There is a particular common surgery that we call cone biopsy of the cervix that changes the milieu of the cervix. That is, the epithelium of the cervix changes, and then that might be hostile to the sperm. So we could use intrauterine insemination for such people. You could also use it in people who are not ovulating. When you have tried to, for instance, you try to induce ovulation and you see that you have induced ovulation and still this patient is not getting pregnant, you could use intrauterine insemination. You could also use it in very mild forms of oligospermia, when the sperm count is not very good, but it's not really very bad. Well, we're talking about sperm count, say between less than 20 million and then up to, worst case scenario, up to about 10 million. Anything below 10 million, one must be careful to use intrauterine insemination in this kind of cases. So yeah, so those are some of the cases where you use intrauterine insemination.